Welcome and thank you for joining us. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Well, we started off 2012 with a wonderful prediction about what we can expect in the coming year. Of course, many of us all around the world have been anticipating the end of the Mayan calendar, and what is that going to bring for us in the world today? On the program, we brought people who were astrologists who came and they gave us our view of what we can anticipate or expect for the future. And a lot of people, for the most part, like to feel encouraged about what they hear from people like this, but maybe there's also an underlying current of what you could call maybe some disbelief or cynicism. Well, on the Beyond 50 radio program, we like to approach things more holistically, so we're bringing on another person who's going to be doing some forecasting for us, but have a more, we'll just maybe call it a logical approach. On the program, our guest today has been forecasting business for more than 30 years, studying trends with an impressive track record in his private and public sector. He's joining us here on the Beyond 50 radio program today as the editor of the Lifestyle section of the Futurist magazine. I'd like to welcome to the Beyond 50 radio program today our guest, strategic forecaster and Lifestyles editor of the Futurist, Mr. David Pierce Snyder. David, thank you for joining us here on the Beyond 50 radio program.
Very pleased to be here.
You bet. Now, you've been on a series of mainstream shows such as Nightline, Today, CNN, MSNBC, and, of course, Beyond 50. And, so certainly when you're on shows like that, you kind of really pull ahead of the pack, especially when it comes to astrologers and crystal balls, where, what you have to really share and say, is really mainstream. Like, this is some real things, trends, things that are actually happening. Tell us how you first got started in this work.
Well, I was with the Internal Revenue Service. Actually,
that's always a good start.
Well, no, my first job coming out of college was at the Census Bureau, and that's when I started doing forecasting and as part of the business census. And then I shifted over to IRS and worked with them, especially early on when they were installing their very first computers. And because that went very well, I moved over, and they made me their chief of long-range planning for about a decade. And the IRS has much better data than the Census Bureau. The Census Bureau only collects data once every 10 years. IRS gets it every year, and they got a bigger stick to bludgeon the people with in terms of actually responding accurately. Mm-hmm. So that gave us some really wonderful base data in order to be able to make some forecasts of the economy, as well as patterns of change in the makeup of society, whether the marriage rates were going up or going down, what the average age of people was, and so forth. And so when I then left the IRS back in 1981, to go into business for myself as a consulting futurist, I had a pretty well-established pattern of the kinds of data that are available that enable us to base accurate forecasts, reliable forecasts, as opposed to all the things that people make money forecasting at, like the stock market. It turns out, statistically, you cannot forecast the stock market behavior from 1 minute to the next, let alone
that's a fact.
A week or a month out. But people make a really good living forecasting.
They sure do. They get you all jazzed up or concerned, and you just kind of follow their advice. Yeah.
Right, and people that stand up there and say, I'm going to tell you how well the economy is going to do this year. And once again, the economy is an enormously complex system, and there are so many variables that can screw up the economy that you can't really make a confident forecast about the economy. But there are three areas of the larger national enterprise that we can forecast about. One is demographics. We can forecast the adult population of the country out 15 years, broken down by age, by race, by gender, so we can describe to you exactly what the labor force is going to be like in 2025 and what the retail markets are going to be like, what consumer populations are going to be. I mean, everybody who's going to be an adult 15 years from now has already been born. So this, it's a long lead time in creating adults.
And it's fairly predictable within each decade of a person's age group what their buying habits and attitudes are going to be, right?
Well, that to begin with.
Right.
Then, of course, we also recognize that as people age, their buying habits change.
Exactly. That's what I meant by decades. Like,
right.
From 10 to 20, 20 to 30, it's pretty fairly predictable what a person is going to do in those 10 years span.
Absolutely true.
Okay.
And when you're talking about 300 million people, that gives you an aggregate ability to talk about then what kind of products will be in greater demand versus lesser demand, which says that we can forecast the structure of the economy, which sectors of the economy will grow and which will decline. We can do those out about 10 years with considerable reliability. And then finally, technology. We can forecast the kinds of technology that will be in mass market use out about 7 to 8 years, because there's a pipeline for technology, and if you simply read the technical journals, you know what's in the pipeline, when they expect it to come out, what the technology can do, and how much it'll cost. Now, one of the things it doesn't tell us is, what are the consumers going to do with that technology? That's the wonderful thing about our free society. People go out and invent all kinds of interesting ways to use the technology the inventor never had in mind. So it's not to say that you can forecast the future with any perfection, but you certainly can say some basic important things about what we know for sure will occur in the next 10 to 15 years. The best example is the American baby boom generation. 78 million Americans born between 1946 and 1964. Last year, the first of them began to turn 65. And now 7,000 people a day are turning 65. By 2015, the number of people over the age of 65 will be the largest age group among all American adults. And 9,000 people a year will be turning 65. By 2020, it'll be 11,000 people a day turning 65, and the total number of people in America over 65 will make up 1/5 of all the adult population. By 2025, the total will be 1/4. Think about that. 1 out of 4 American adults will be over 65. That's an aging society. Well, now, what's important about that? The over 65-year-olds consume more than 2/3 of all the health care in the country. So if the over 65 population is going to explode, which we know for sure is true, then we also know that the healthcare industry, which is already the largest industry in America, 17% of our gross domestic product, 20% of all the workers in the country, that's going to explode in size. And Congressional Budget Office says that by 2020, it will be 20% of the GDP will be healthcare, and by 2025, it'll be 25%. So a quarter of the entire U.S. economy will be in healthcare. And that also says, by the way, a quarter of all the jobs will be in healthcare. So for those people that are contemplating either beginning a career or switching a career, your best option is going to be healthcare. And you see that in the daily news every day, that, well, all these other places are having layoffs, but healthcare isn't having layoffs. Healthcare is growing robustly. And then finally, you add to it the things we know about technology. And one of the things that's going to happen to healthcare over the next 10 years is that under federal law, all hospitals must have electronic medical record systems by 2014. And all individual doctors must have electronic medical record systems by 2017. And there are so many errors in our healthcare system that kill hundreds of thousands of people a year. And all of those will be eliminated by electronic medical records. So the quality of healthcare will go up over the next 10 years, and the cost of healthcare will go down because of the wonderful efficiencies that electronic medical record keeping will enable us to institute in healthcare in the first place.
Well, David, just on that note, too, when you say that the healthcare is going to go down, I would say because of the efficiency and the accuracy of the healthcare, as you just said, a lot of people die as a result of, the wrong information or bad information, whatever it may be. is that now it would go down because the trend for lawsuits due to malpractice would go down. Is that kind of a way of looking at it
now,
as well?
that might well happen, but here's one of the interesting dimensions of that.
Okay.
We think of healthcare as a segment of our economy that's largely made up of independent practitioners. Up until about 2005, 3/4 of all the medical practices were owned by doctors. But as malpractice insurance rates have gone up, and largely because the amount of malpractice has gone up, a great number of individual practitioners have said, wow, I can't afford this malpractice insurance anymore. And what's more, the government's now going to make me install an electronic medical record system. I don't want to do that. But here is an health insurance company that says, we're looking to buy medical practices so that we can manage the practices and reduce the healthcare costs by prescribing best practice by the doctors. And then the hospitals around us are not only are they consolidating into a handful of huge nationwide hospital companies, they're buying individual healthcare practices as well so that they can have a network of people who work for them as salaried employees and have to follow their management principles and their medical practice guidelines, and that will also improve the quality of health care. So a complete transformation is about to happen to the largest industry in America, healthcare, right before our eyes. It'll all be done in 5 or 6 years, and suddenly, instead of everybody going to individual doctors that are self-employed medical practices, it's all going to be huge national corporations with salaried employee doctors working for them.
Now, first of all, I want to wonder, is this going to be a good thing? And the reason I say that is back when President-elect Obama was running for office, he seemed to be attacked on his health care issue based on the fact that this is a socialist approach where everybody gets health care. In fact, I thought primarily, I wasn't really listening to him, but I thought, every W-2 wage earner in America should have access to health care at one level or another. And I've actually talked with a couple of medical professionals about this. Just to me, it seemed like a good idea. Like, for instance, you're in the military, you get health care and dental and vision and all that. So if they get it, why can't they apply the same rules to, let's say, the civilian population? They said, well, that's socialist to a degree that works, but then on the other hand, you sort of lose choice to really, really good care if you need to.
That's our perception.
Okay.
And
tell us about the reality of how this could be better.
And almost all of the other mature industrial economies have a single-payer type system.
Right.
Because
a lot of countries were attacking U.S. for even having that attitude of saying, socialists, what are you kidding? It's working well for us.
Oh, well, it absolutely is. And, of course, all those plans have an escape clause that says, look, if you've got enough money that you don't want to go to the public practitioner or those that are covered by the government insurance, that's fine. You go out and buy from people who figure that I'm going to treat the carriage trade and I'm going to be that much better than everybody else. So that's what happens in Canada. That's what happens in Great Britain and Germany and Japan. Mm-hmm. They all have that kind of escape clause for those people that have enough money that they can afford to buy first-class health care.
Sure.
The problem is that mainstream health care in our country is not nearly as good as it is in all of the other mature industrial economies, and its cost is much higher. The average American pays more than twice as much for health care as any other mature industrial economy's citizens.
Wow.
And we get much worse health care. And the reason is that there's no one managing all of these independent doctors. You walk in the door, you give them their symptoms. There's not even a standard record system, so if you don't remember all the things you've been sick with over the course of your lifetime, or
you're in the waiting room for 2.5 to 3 hours while they discover who you are.
Right. The older we get, and they say, what medications are you taking? Oh, let me think about this a minute. There's a whole windowsill over the sink of all these pills I take. And if I forget one and then they prescribe me a new drug that has a bad interaction with the one I'm taking that I forgot, suddenly the system has made me sicker.
Mm-hmm.
So a combination of all of the changes, what's in the Healthcare Reform Act, which is not by any means the best kind of Healthcare Reform Act we could have had. We could have had something like any of the European countries have. But instead, because of the political conflicts arising from that issue, we got a kind of a hybrid. But hybrid or not, it will in fact institute a number of standards and a number of technological helps that will in fact transform the quality of American health care up and reduce the price. And it's fairly clear that that's absolutely certain going to happen over the next 5 to 10 years.
You know, David, you bring up some really wonderful points about comparisons. And, you know, over the last 5-6 years that we've been broadcasting the show, actually approaching our 8th year next month, but that I've noticed that we tend to call ourselves here in the United States the more advanced country, okay?
Right.
But I've noticed in things such as what you're talking about, healthcare, beauty, you know, things like that, just basic everyday lifestyle choices, we seem to really be behind the 8 ball in countries or areas such as like Europe or Asia. You know, right now it's becoming mainstream more and more about what they call alternative or new age healthcare, such as acupuncture, diet, and all this. And it's like, you know, what takes us so long to do something that's been around for so long that everybody else is using and it's working well?
Well, first of all, you've got to take a look at the developing world, like the Chinese and the Indians, who have had cultures that are basically older than Western civilization.
Mm-hmm.
And they grew up separately, developed their own medical arts. And by the way, let me just mention in passing, one of the very first futures projects that I worked on at the Rand Corporation back in the 60s was a request from the Johnson administration to